the participants for joining us today. So as Andrew said, the title of my presentation is, Are Extractable Leachables Going Phase Appropriate? Another way to look at this is, what is the requirements right now in terms of performing extractable leachables for clinical trial materials? Are there any requirements, and where do we stand? This is kind of brought up here fairly recently based upon some experience that we've had here at ABC with some kind of new trends that we're observing. So some of this, a lot of this is based upon our observations. So as part of this, we're also looking for feedback at the end of this. So there are going to be a couple of poll questions, just trying to gauge some of your experience, and if anyone is experiencing some different feedback that they're getting from the agency. So in terms of agenda, I want to give some generic background information first on extractable leachables, just to make sure we're kind of all in the same level playing field. What the current regulatory and guidance situation is for extractable leachables. Observe trends for clinical trial materials of what we're seeing now. Regulatory guidance for clinical trial materials. What, if anything, is out there? What are some various different clinical trial material scenarios? What we're observing? Can we break those down into subgroups? And then some overview of some case studies, and then a summary. So first, just some brief overview. Of course, what are extractables versus leachables? An extractable, of course, is a compound which you can, under aggressive laboratory condition, pull out of the contact surface or the material that you're testing. A leachable are normally subsets of extractables or compounds that, under the actual conditions of usage, migrate from the material and into your drug product. It's very important to understand that extractables and leachables don't always equal each other. Extractables don't always leach, which is a very good thing. But then sometimes leachables don't always extract. We'll go into specific cases, but it's important to understand that relationship. So what are the overall sources? Of course, the most common one everybody's familiar with are primary packaging components. Secondary packaging components for some drug products, it becomes important, especially for foil overwraps, labels, inks, and dyes, which have been shown in the past to also be a source of leachables into the final drug product. Associated dosing components, these would be like medicine droppers, infusion sets, IV sets, those things that are used to dose the drug. Processing components, basically manufacturing equipment, single-use systems, anything that's used in that manufacturing process. And then supply chain materials. These are very rarely a source, but as we observe with some of the issues from Tylenol and Lipitor recalls, they can be a potential source, although albeit in the extreme case, for a source of leachables. So if we look at what is the current regulations on them, if we look at 211 for both drug containers and equipment, they basically say the same requirements, is that the drug product containers or the equipment that's used to manufacture them essentially are not reactive or additive to affect the quality or purity of your compound. 600 for biologics essentially says the same thing. For both equipment and containers, that they should be free of leachable contaminants. Now, of course, this is mostly dealing with, again, the data that required for your commercialized or for your registration product. So if we look at the regulatory guidance that's available, there's limited guidance available from the FDA in relation to extractable leachables. There's the 99 container closure guidance, and then a series of specific guidances in relation to inhalation devices for nebulizers, MDIs, DPIs, and then one on semi-permeable. All of these contain some good information on extractable leachables, but really what they end up saying is you need to do evaluation of extractable leachables. They don't necessarily get into the fine detail of how to perform them, what you need to look for, and more importantly, sometimes how low do you need to go to, at what level do leachables become a concern. For that, we rely on industry organizations or other outside sources. ICH, USP, P2RI, BPSA are just some of the examples. The USP is coming out with new chapters for extractable leachables, which I think will be very useful. The P2RI has a best practice document for inhalation devices. They also have a working group currently working on a best practice guidance for parenterals and ophthalmics. BPSA mainly deals with the bioprocessing equipment, single-use systems. And one thing that's important is from all the regulations, the best practice guidances, recommendations from the various different organizations, all of these really deal with the data and information that's being submitted for your final registration, i.e. what's being filed in your NDA, BLA, or new drug application or new animal drug application if you're doing a veterinary product. They don't really go into what are, if any, what are the requirements earlier on in the developmental process. Are there any requirements? So if we look at what the current overall scheme is in terms of the development of an extractable leachables program, all of those essentially have the same type of flow to them. You start with an information gathering where you go through and you gather what all the information is available on the contact materials. What is the material of construction? How is it made? What are the additives if possible? Using your dosing information, you determine what the safety concern threshold is, and then also analytically how low to go, which is the AET. I'll touch base on a little bit more on that in a second, but I won't go too in-depth on it because I want to get to the main point of the talk. Perform your controlled extraction studies. Develop and validate extractable control methods if it's required. If you already have some aged product available from earlier phase studies or from R&D batches that are using those same materials, analyzing those for potential leachables so that you can use that information to help guide the development and validation of your leachable methods. If you do observe compounds above your analytical, of course, going in and identify them. And then getting everything in place, of course, for your leachable QC and stability testing. And if you do have leachables that you've identified above that, performing any leachable tox evaluations that are needed. It's a very stepwise process. To walk through this, it's a very thorough process, but it does take a fair amount of time to perform this and walk through all the steps for your registration data and information. So just to touch briefly on the safety concern threshold, or basically how low to go, I won't get too much into it as we talk through this today, but it's important to understand that this can become very important sometimes when making evaluations on materials. The dose makes the poison. It's a toxicologist's favorite saying from Paracelsus. Essentially, everything is toxic. It just depends upon the dose that you're getting. There's no really direct regulatory guidance available for extractable leachables or for leachables in the final product. There's a genotox guidance, which recommends 1.5 microgram per day. Ophthalmics is the one area that has at least published in terms of a presentation levels for their expectations for leachables, which is a 1 ppm reporting, 10 for identification, and then 20 ppm for the qualification of those.